One of the most important things in medicine is to treat each patient as an individual. Each one has their own primary concern when it comes to their varicose veins.
Blood in your legs is supposed to come back up to your heart, okay? And you have valves that kind of help move it along. When you have varicose veins and venous insufficiency, the valves aren't working properly.
Most people take a look at their legs and they think it's vanity or it's a cosmetic issue when they see these veins in their legs. Unfortunately, venous disease is progressive, and if it's not treated, it can be very debilitating and deteriorate your quality of life.
So I started noticing I had a lot of swelling in my right ankle particularly, especially after being on my feet for duration of the day.
My legs were tired. They got hot and itchy in certain spots, which I didn't know that was because of the veins.
It kind of felt like tightness into my calves, rubber bands, kind of like gripping around my ankles.
By the end of the day, my legs were dragging, you know. The most I could do was get home, sit on a chair, and just put my legs up.
I noticed a lot of dark purple, discolored veins along my whole, around my knees, into my legs, and even my thighs.
When these veins start to expand and you can see them in your legs, you get symptoms of cramping, itching, swelling. It becomes very difficult to even do the most normal activities you used to do.
A lot of patients come in thinking that, oh, it's, my vanity, and it's not. But it is a medical condition, easily treatable, and it is covered by insurance. A lot of patients don't recognize that.
With the new technology that came out, the laser-based, what we call endovenous surgery, minimally invasive surgery, or procedures really, that are done in the office, there was a paradigm shift in the field. The patient can immediately go back to work, immediately go back to exercise, immediately go back to their normal routine, because we're working under local anesthesia, which is very, very safe, no sedation, no general anesthesia.
I look forward to my sessions with Dr. Chuback, and to have him do the work on my legs, it's unbelievable, virtually painless.
He really completes the procedure so quickly because he's so good at what he does. I'm like, that was it? It's over already? He's like, yeah, that's it. You get to go home now. The procedures were so easy, I would even come on my lunch break and go right back to work afterwards.
And today, my wife is telling me that my legs are looking better than hers, which I can't believe. I didn't want to go on the beach. I mean, my veins were like ropes going around my legs. And today, you don't see any of that.
After I had the procedure, it kind of gave me like a more pep in my step. Like I felt like I had so much more energy in my legs because the toxic veins were gone. To feel the difference was amazing. And I wanted to go to the gym more, and I wanted to do more because physically I felt better.
I have energy now, which I didn't have before. I feel good about myself because of Dr. Chuback and his whole group.
By the time they're done with the procedures, patients come in here with cookies and cakes, and they're giving us hugs, and they're just so happy. And it's amazing to see how they went from uncertain and unsure to having a greater quality of life. And that is what we're here to do. That is what it's all about.